So this was kind of an iffy video to make because a man lost his life. The United Healthcare CEO, Brian Thompson, was murdered in cold blood. It looked like it was a premeditated, targeted attack. And we'll get into why this can somewhat relate to artificial intelligence and the use of it. Now, we know at this point nothing. We don't know who the alleged murderer is. We don't know if it was in fact a targeted attack, even though everything does allude to that fact. So I'm kind of putting my lawyer hat on and being very careful with my words. But we had bullet casings. And bullet casings were found. At this point is the only evidence that seems to be released beyond the security cam footage. Be very cautious. It is on X. I happen to come upon it, and just seeing something like that just can, it's not something you really want to see ever. But police sources told the New York Post that the words deny, depose, and defend were written on the live rounds and casings left behind by the assassin after the shooting. Why is deny, depose, defend very interesting? Well, the X account Unusual Whales posted, murdered United Healthcare CEO has been receiving death threats about lack of coverage his wife has said, per the Wall Street Journal. A lawsuit filed in 2023 that United Healthcare was using an AI model with a 90% error rate to deny care, per Reuters. That was back in 2023 when this was originally posted, November 14, 2023. Lawsuit claims United Health AI wrongfully denies elderly extended care. We don't need to go in this article because we have the actual class action complaint. Looking at it, this putative class action arises from defendants' illegal deployment of AI in place of real medical professionals to wrongfully deny elderly patients care owed to them under Medicare Advantage plans by overriding their treating physicians' determinations as to medically necessary care based on an AI model that defendants know has a 90% error rate. Now, at this point, we don't know if this is in fact what is happening. There's just a lot of assumptions. There's allegations being made. This class action lawsuit is filed. From what I could find, I still don't know what has come about it. So I'm sure it's going to be stuck up in the courts for a long period of time. They have this NH Predict model determines Medicare Advantage patients' coverage criteria is post-acute care settings with rigid, unrealistic predictions for recovery. Insurance is just a big scheme in some aspects that we pay into it in the hopes of never having to use it. And that's how insurance works. If everybody who had insurance files claims at the same time that are approved, then where's the money going to come from, right? So reviewing, denying claims, putting criteria in place, it's a really bad business. In fact, at one point when I was going to attend medical school and I was working in hospitals and various jobs, I worked in medical claims collections. It was the worst job ever. People that didn't have the money to pay it, calling them. And I lasted, I think, maybe 2 weeks, and I just got up and walked out of the job. Absolutely hated it. So they say that something alluding to the fact that they just quit relying upon expert opinion despite fraudulent scheme. Largest insurance defendant states that their mission is to help people healthier lives. Defendants a model. Defendants purport to predict how much care an elderly patient should require, but overrides real doctors' determinations as to the amount of care a patient in fact requires to recover. As such, defendants make coverage determinations not based on individual patients' needs, but based on outputs of the NH Predict AI model. Very dangerous, resulting in the inappropriate denial of necessary care prescribed by the patient's doctors. Defendants intentionally, this is what I was looking for, limit their employees' discretion to deviate from the NH Predict AI model prediction by setting up targets to keep stays at skilled nursing facilities within 1% of the days projected by the AI model. Employees who deviate from the NH Predict AI model projections are disciplined and terminated, regardless of whether a patient requires more care. I think there's another article discussing that. United Healthcare's disturbing track record of rejecting claims. This was just another article regarding such. Argues algorithm lawsuit should be dismissed because patients didn't spend years appealing denials. That's insane. But if you're an attorney for United Healthcare, it is interesting that if you don't have patients who appeal the claims, then why are they all of a sudden filing a class action lawsuit when there are ways and avenues for patients to follow up? And some people just don't have that time. So that's what's at stake. Now, denial of claims. Where does United Healthcare sit? Now, I have no way of verifying this Value Penguin and Lending Tree study that was posted. I actually first ran across it within the replies here, but I also have no reason to believe that Value Penguin or a name like Lending Tree would post something that would be false. And you can see here that the industry average, as posted by Value Penguin, of denial of claims is 16%. Where is United Healthcare? All the way down here at the bottom at 32%. Now, the whole discussion that I wanted to focus on with the use of artificial intelligence is that there's a responsible AI aspect. It is not something that should be 100% relied upon. The ability to leverage an AI model in the case of evaluating claims is interesting. It can help the people doing such accelerate their ability to look at a large number of claims and even find certain patterns, anomaly, fraud detection, because, not to defend insurance companies, people do file fraudulent claims to collect money. It does happen. And this is what you want to mitigate, because when there are payouts for insurance, everybody's premiums go up. So we want them in all industries of insurance to mitigate that risk. And how you do that? Well, AI is a good way to do that. But responsibly, putting things in place that still keeps it as a very valuable aided tool, but not the end all be all that could potentially lead to just catastrophic, life-changing instances that people are going through that would result in a class action lawsuit when there are just so many individuals that are suffering from this. So that's kind of where the discussion is. Again, we have no idea on 100% what the motive is, but it is interesting that certain things are alluding based on, again, the bullet casings denied, depose, and defend, and the fact that, per the Wall Street Journal, the wife of the now deceased, unfortunately, and, prayers to the family, United Healthcare CEO Brian Thompson was receiving death threats for the lack of coverage. And I'm sure he's likely not the only one within this industry having to deal with such. And what a shame. Two wrongs don't make a right. It's just the big takeaway: responsible utilization of AI.